Today we are going to talk about facial scars and how to get rid of them. It is a common expectation of patients that a plastic surgeon can remove a scar completely. Well, that is not at all true, and for that we have to understand how a scar really forms. Any injury to the body would generally result in a healing process, and the end point of this healing is formation of a scar. Thus, contrary to the common belief that scars are aberrations, they are not so. They are actually quite normal, and it's quite normal to form a scar after healing of any wound. So, if scars are normal, why is it so that some scars are ugly and some scars are better? So there is a reason for that. Scars which are there in anatomically and aesthetically important areas can cause distortion of these structures like eyebrows, eyelids, lips, and thus they appear ugly. Some patients have an inherent tendency to in which there is exaggeration of this healing process, and they form hypertrophic scars or keloid scars. Then it also depends how the wound had healed. A wound which has been left open, which was infected, had bleeding, will form a bad scar. However, a wound which has been delicately and meticulously sutured with fine sutures by a plastic surgeon will have definitely a good scar than otherwise. It also depends on the placement and the direction of the scar. Scars which are along, which is something called as resting skin tension lines, are generally good scars. Those which are perpendicular to the RSTLs, they are bad scars. Using the above principles, plastic surgeons can generally do a procedure which is called as scar revision, in which we basically excise the scar, reorient it if required, and then suture it delicately, meticulously with fine sutures, and this procedure is called as scar revision. Again, I would like to reinforce that the aim of a scar revision procedure is to make the scar lighter and not to make it disappear completely. Generally, after doing the scar revision procedure, the sutures are removed as early as possible, generally on the 5th day of surgery. Post-surgery patients are required to avoid exposure to sunlight because it contains UV rays. This protection is in the forms of clothing and sunscreen lotions. Then these patients are also expected to apply pressure over the scar, which may be in the form of pressure garments, but mostly a simple massage 4 to 5 times a day suffices. The scar also requires a bit hydration, and for that we prescribe silicone gel to the patients. Generally, scar revision can be offered to most of the patients. However, there are some exceptions to that. In some cases where a scar revision surgery is not possible, a plastic surgeon may refer you to his dermatologic colleagues for alternative methods of scar treatment like laser resurfacing, chemical peels, and intralesional injection of steroids.